can't buy. It resides between my eyes. Walked through the fire, came out better on the other side. See, life's like a beach if you find the sand. And right now, I feel like 100 grand.
You are listening to Inspired Insider with your host, Dr. Jeremy Wise.
Dr. Jeremy Weiss here, founder of InspiredInsider.com, where I talk with inspirational entrepreneurs and leaders. Today is no different. I have Jeff Spanbauer of Relevate Health. And Jeff, before I formally introduce you, I want to point out some other episodes people should check out. This is part of the Top Agency series, and Jeff has an incredible journey. And so there's some other ones you can check out. I had one with Kevin Hurrigan, who's been agency owner since 1995, what the landscape was like then, and still doing it today and growing. It's Tech, and Scott Scully, founder of Abstract Marketing Group. They specializes in a lot of like auto. They do B2B lead generation, and he's done it for the past 28 years, and they're growing to over 70 million in revenue. And Todd Taskey, he has a Second Bite podcast, and he helps match agencies with private equity. So sometimes they have more on the second bite than they do on the first. And Jeff knows a little bit about private equity, and we're going to talk about that as well. But and more episodes on InspiredInsider.com. And this episode is brought to you by Rise 25. At Rise 25, we help businesses give to and connect to their Dream 100 relationships and partnerships. And how do we do that? We actually help you run your podcast. We're an easy button for you to launch and run your podcast. We do strategy, accountability, and full execution around a podcast. And, you know, Jeff, for me, the number one thing in my life is relationships. And I'm always looking at ways to give to my best relationships. And I found no better way to do that than the profile of the people and companies I most admire on this planet and share with the world what they're working on. And guess what? I get to learn from them too. And so does my audience. So if you've thought about podcasting, you should. If you have questions, you can go to rise25.com. We've been doing it for over a decade, and I always say it's the best thing since sliced bread, so check it out. And today we have Jeff Spanbauer, co-founded Healthcare Regional Marketing. Now it's Relevate Health in 2007. He's led 4 acquisitions and integrations to really transform from a niche player into the healthcare platform engagement leader in the life sciences industry. With 200 colleagues supporting 185 brands and 15 hospital and health systems. He's partnered, I mentioned before, Jeff, he partnered with PE investor Mountain Gate Capital to grow revenue to 70 million plus. He scaled his company starting with 2 people, I think in a basement somewhere, and growing to 200 people. And his experience, you know, Jeff, what's fascinating is your experience comes from a combined 10 years with Pfizer and Procter & Gamble. Jeff helped, and you know, he's a humble guy, but I'll say this. He helped drive over $1 billion in sales with these companies while working with some of the top brands in the market. So Jeff, thanks for joining me.
Hey, it's a thrill to be here. Thanks, Jeremy.
So talk about Relevate Health and what you do.
Yeah, so Relevate Health, real simply, we're experts in engaging healthcare professionals, so doctors, by using data and marketing to create relevant ways to be able to create value for them. And so we're working with about 1.4 million doctors across the U.S. day in, day out, supporting the 185 brands you mentioned. And it's really around omnichannel marketing. How do we surround sound the doctors with content that's helpful for them in their practice, and serving up to them at the right time so that they can use that to get the best outcomes for their patients.
Everything, it seems like, you have a North Star in your company, and I love to hear how you came to that, but life-changing healthcare engagement really, it seems like it helps drive decisions, maybe people and services. How did you come to that succinct piece?
Yeah, it's even though we're marketers, it took a while to really figure that out. And so, one of the things that helped me was I read a book by Patrick Lencioni called The Advantage. And, coming from P&G and Pfizer, where we had these really great, visions and purposes, but they're really long. The whole idea of The Advantage was if you can create a succinct way to kind of explain your vision, your purpose, and your values, it creates clarity in your organization, and clarity drives a better culture. And then a better culture drives this huge advantage for you as an organization. And so, kind of giving you the, back in when we started HRM, our purpose was, grow the business. Like we didn't have a lot of, fancy, kind of thinking around that. It was really this idea of, we can help brands, market better through data and analytics, to get their message to the market in a relevant way. And, we did that and we had a lot of success. We started off the company, grew it to about 15 million in the first 4 years. And we're like, hey, this is great. We should have started this a long time ago. And then 2012 hit and we took it from 15 down to 6. And doing that was really painful. And it was hard, and it was really hard on our culture. And I didn't realize how important culture was until after I went through that experience, read The Advantage, and it was like, hey, we really, we need to do something different here to really have a very clear vision, purpose, and values. And then ever since 2012, we've been working really hard at doing that. And with the different acquisitions, we've kind of tweaked it. But our vision, and a vision, something you're aspiring to, you never reach, is to, every communication is relevant, which really ties back to Relevate Health. And this purpose of life-changing healthcare engagement, that gets me excited to come to work every day if I'm helping people, leverage, use my skills in a way to really serve people and help them be able to do something that's impacting lives in a positive way. And then we have core values, 4 core values right now. It's called our PACT, P-A-C-T. It stands for pioneering, accountable, caring, and transparent. And so those values kind of really give us this clarity in the organization on when we hire people, if we have to fire somebody, when we do reviews, every month at our town halls, we recognize people based on their core there's peer recognition actually, where peers recognize each other for these values. And so that's kind of how that came together. And, we're continuing to tweak it, all the time. But for the most part, I would always start our town halls when I was CEO as, hey, let's talk about our vision and purpose. And even though I got tired of talking about it every month, and we had people joining every month, I had to keep reinforcing that to make sure that new people heard it. And quite frankly, some people may not remember it. And so that part of being the leader is also being the chief communication officer, or the chief reminding officer, and reminding people kind of why we're here and what we do. But it's great having a purpose that is so kind of externally focused and really trying to help people live longer, healthier lives. And that's one of the benefits of being in the healthcare space.
We'll talk about some examples. And Jeff, there's so much to unpack on what you just said. But can you just repeat the core values for a second? And I'd love for you to talk about how do you have peers recognize each other in the company?
Yeah. So the core values, we call our PACT. So kind of our promise to each other, and that's pioneering, accountable, caring, and transparent. And so that, and we define each of those with a few words to kind of explain what they are. And there's different ways to be able to kind of live those values. But one of the things we do internally is we're transparent. I'm a big believer, and I've learned this through my journey. If you and I have similar data, we're probably going to make a very similar decision. And if I'm making a decision and you don't understand why I'm making it, that means there's a big gap in data. And so we've been really clear about trying to be transparent. So we have every 4 to 6 weeks, we'll have a town hall, and the town hall invites everybody to the company to come, and we record it for people who have client meetings. And prior to the town hall, our leader in HR reaches out to everybody and says, hey, we'd like to get peer nominations for people who are living the PACT. And so people can submit into HR different, ways that, Jeremy or other colleagues have lived, a value by, somebody who, went the extra mile in caring for a client, or somebody who, made a mistake, but then owned it and fixed it and they're accountable, or someone who tried something new for a client or internal and we're pioneering. And so those are all examples that happened the last 20, 25 minutes of our town hall. And quite frankly, it's probably the best part of our town hall. I know our people like it the most because you're recognizing each other. And it means a lot when it comes from a peer versus from a manager or a leader in the organization. And so, I did that as well. And I would do that more one-on-one. But for a lot of people, being able to recognize each other just creates this caring culture where we're paying attention and saying thank you. And, you never see people's smiles bigger than when they're being recognized by a peer for something that they went above and beyond on.
I'd love to hear, mistakes, or we'll call it learnings, right? And you mentioned, I know in your journey, and you just mentioned going from 15 million to 6 million.
Yes.
And one of those learnings is a customer concentration thing. But talk about some of the learnings that, we could start with that one.
Yeah, that one was a really hard one because we had a client who, they didn't hire us the first 2 years when my co-founder and I started the company, because we both had left, the company. It was Pfizer. And, but once we, got established and added some value and had kind of a team, there was an internal restructure, and they went to a very regional structure. And they reached out to us and said, hey, we need your help. And it was like, okay, great. And it was so great. We grew from, basically very little in revenue with them to about 10 million a year of that 15. And, in a lot of ways, we rationalized it, internally, like, hey, this is great. When you have a big client, you can really focus on them. You can really go deep, their processes. We came from there. We know a lot of people. It was really a great partnership on working together to be able to really help them grow their business and be able to do it in a way that we were basically an extension of them. And so all that was good. It was a good margin business for us. And we've, felt like, hey, this is great, because, you don't think about when it's going to end. You just think about, as you're growing, hair on fire, how do you get stuff done? How do you hire people? But in 2012, they had a big restructure because one of their big drugs, Lipitor, was going generic. And that's one of the challenges in the life science space is you only get 17 years with a drug before it goes generic. And usually the first 10 years is you're doing clinical trials. So it was
like a 7-year span there.
Yeah. So they're very, they got to aggressively market to try to make all the money, the $1 billion they invested in a drug back in that short period of time. Fast forward to, kind of rewind back to 2012 for us, what happened is, they restructured, and we, went, from them, probably from 10 down to 2 with them. And so that was extremely painful. If I look in the mirror, it was, my fault that I didn't do a better job diversifying back then. To prepare for the day that they were no longer going to be such a large client. The hard part was, or the sad part for me was having to tell, 10 different colleagues, hey, sorry, we're going to have to let you go. And we did all the right things. We had a training package with right management where they can go and get, some career counseling. We gave a severance, we did all the things that kind of fit our caring culture. But there's nothing worse than, knowing that I could have prevented this by, maybe spending less time focused on that business and more time focused on how do I get new business. And so after we went through that painful experience, and I remember like meeting, people in the conference room with HR, each one-on-one, and then going out and getting somebody else and bringing them in. And, at some point, everybody was hiding from me because they didn't want me to come pull them into the, conference room to have that conversation. So it was really a painful moment. That was really when I kind of, came to the conclusion, like, we can't, this is not a great way to run a business. I mean, that was, my MBA school teaching taught me like, hey, you shouldn't be concentrated, but when you're living it, you can rationalize a lot of things. And so that was a really, pivotal moment for us to say, hey, let's rebuild this business, but diversify it. And as we grew it back to about 18 million in 2020. And I think we had nobody was more than 10% of our business at that point, because we just learned a lesson. It's better to say no than put yourself in a position where you're going to have to deal with all these challenges later. And that was, a lesson that, was pretty painful from a culture and from a people perspective.
So one is really diversification of customer revenue. Are there any other big ones that stick out from your?
I think the whole culture thing, right? Because going through that, probably the biggest thing was culture, because, it probably took a year, 2 years, maybe 3 years for people to trust me again internally. Because, that's where I started becoming much more transparent. It's like, hey, if you had the same data I had on what's going on, you would also probably make a similar decision, as hard as it is to be. And, part of my job as a leader is, you have to trust me to make the hard decisions, because if I don't make the hard decisions and put us out of business, that doesn't help anybody in the organization. And so that was a big learning is, that's where I kind of got connected with the Advantage by Patrick Lencioni and really started thinking about how do we build a culture that's a competitive advantage for us versus something that's, people just show up, do their job and go home and don't have a lot of, care for the business, care for our clients. They're just kind of punching the card. And that was probably the biggest learning that I've spent the last, 10 years really working on to build a culture that we have now, which, I'm very proud of. And we're attracting really, really, really strong people because of our culture.
Yeah. So I want to talk about building culture. But yeah, it's funny you say that, Jeff. I need to check out that book, Patrick Lencioni's book, Advantage. I remember the Death by Meeting book, and I can still remember the cover. What I love about his books is they're short, parables. They're really informative. And also, I think there's 5 dysfunctions of a CEO one. So I'll have to check out Advantage.
That's a great one.
Building a culture. What are some things that people listening that you've done that people can learn from?
Yeah, like one of the things that was not natural for me when I started, I always had this division between professional and personal relationships. And we ended up, there's a process called scaling up that we hired.
Vern Harnish was on the podcast.
Yeah. So we hired one of their coaches. And one of the things they did, is one of the rhythms that we did is we had a weekly management meeting with my ELT, my executive leadership team. And we had to share our personal high and personal lows, in addition to our business high and business lows. And I was the way I'm wired, I don't really think about lows. I just kind of think about what's ahead and how do I, kind of focus on that. But coming up with personal highs, but also personal lows was really, really kind of new to me. And, we had talked before this conversation about EO, Entrepreneurs Organization. I'm in a forum here in Cincinnati, and it's been great for me because one of the things we've worked on is personal growth. And we use a program, we use a kind of a system called Enneagram. I don't know if you've heard of Enneagram, but it's kind of like a Myers-Briggs or a DISC, and it helps you to kind of define who you are and how you're wired. And so luckily I'd been doing that work prior to hiring this coach who came in and talked about personal highs and personal lows and the importance of being vulnerable to your team. And so that was kind of a new thing. But, through that, I would share personal highs, personal lows, business highs, business lows. But then the rest of my leadership team did the same. And the stuff you would just kind of know about, you learn about the person on their personal lows and even personal highs, just creates a much deeper relationship, a higher level of trust. That wasn't natural to me because working at P&G and Pfizer, you didn't really talk about personal stuff that much. You just kind of did your job and kind of separated it. And so learning to be kind of a full manager, not just, it
goes into the transparency part of culture too.
Absolutely. Because now, like, hey, someone's got a health issue or someone's in their family's sick or, those, that all affects how we perform at work, but you don't know why people are, behaving some of those times. And so that just gave me a lot more perspective of, hey, people are people and it's okay to have a strong relationship with them. And, quite frankly, part of being caring in our culture isn't about being kind as much as telling people the truth, my kids are the first to tell me if my outfit doesn't match or something, but that's, that's caring, right? Like that's, they don't want me to go out and embarrass them, right?
Kids are brutally honest. Yeah,
exactly. And so part of the culture is, there's a book called Crucial Conversations that we introduced a few years back to help people to be able to have the harder conversations coming from a place of love in your heart and caring for people. Because that's what we all need in our life, for people around us who can tell us the truth and be honest. And, like my experience as CEO is sometimes I'm the last guy to hear the truth. And so trying to drive that in my culture takes more than just telling people they have to do it, but really getting to know them. And so that was the personal highs and personal lows was a new thing for me that I thought was really, really valuable, because now I could ask people about their family and I could, cheer them on, if they're trying to do some kind of fitness goal, or if they have a health issue, we can all surround them and, help them through that, those issues. So that'd be one. Another thing I did regularly was any new hires, I would meet with them. Most of the time now it's on Zoom. Previously, when it was more geographically easy, I would meet them in person, but I always felt like it was important to have a relationship with everybody at the company. And, as we get bigger, it's harder and harder, but that, I'd have some welcome to Relevate meetings where there'd be 9 or 10 new hires that month there. But still, my policy is, hey, I've got an open door, open Teams. We use Microsoft Teams. So if there's any ideas that you have.
Open Teams. Yeah.
If anything any ideas you have or questions, always feel free to reach out. And then the other thing that we've done from a culture perspective is we use Office Vibe. And Office Vibe is a system that will reach out to you, about every 90 days to get feedback on how the company's doing for you. How do you, what's working? Where are some issues? And ultimately, it helps us give an employee net promoter score. So we know how likely the employee is going to be to recommend Relevate to a friend or colleague. And that's really insightful. And, I'm a big believer that, feedback's a gift. And as much as I may not want to hear the feedback because it's critical or it's different, I've learned, through this, kind of development of myself, like there's some truth to it. And if I can understand what, get some transparency into why they're thinking that, what they're seeing, that's just going to help me be able to be a better leader, but also more importantly, have the company be a better organization that meets the needs. So those are some of the things we do on a regular basis. That's really helped us build a place of transparency, caring, accountability, and pioneering in the organization.
Love it. Yeah, Jeff, thanks for sharing that. It's super valuable. Also, I second the crucial conversation. I actually had Joseph Gurney on the podcast.
Oh, awesome.
You can check out that episode with him. It's really incredible. Jeff, I'm really curious how, if you can take us through the evolution of the positions that you held at the company and how you had to grow, right? Because I know you started as 2 people, you had to sell. And then when you look at it, I don't know if it's I've made it moment, but when you look at it as someone's chairman of the board, it's like, that's, to me, when I look at it, there's no I've made it moment necessarily, but I see that as pretty amazing.
Well, thank you.
That means you are, not running the business. You are working on the business at all times, and you have all the pieces in place. Maybe not always all, but it's always evolving. But you get my drift. So take us through maybe a quick evolution of salesperson. Here's what I needed to grow to the next level, and then each position.
Yeah, definitely. So you're exactly right. As a co-founder, the both of us were out selling. Like, that's job number one. Is you got to create revenue and create confidence and be able to get people to want to, write you a check, right? And so that was a big part of what we did. And the kind of amazing thing in looking back is within the first month, we got hired by 3 major pharma companies. We got hired by Sanofi Aventis, Sanofi now, AstraZeneca, and Johnson & Johnson. And they all liked, my co-founder, Scott Weintraub, we both worked at P&G together. We both worked at Pfizer together. And then we left together to start this company. And they liked our background of kind of having that marketing experience, both in consumer and pharma.
That's a tough sell. I mean, even I know you've talked about this publicly, but even some people at your previous companies like, yeah, we know you too well. We know you're working out of a basement with 2 people. So we're not going to hire you right now. But the Johnson & Johnson, these other companies, they did.
Right.
So,
and funny thing we did with our business address on our card is, I had my home address, but I added Suite 100, and my partner, I think, added Suite 201. And so, at least it gave some level of there's something going on. And I kind of joke, that's the way we, routed mail in our house to my office in the basement. But that, gave some level of there's, these guys, have some type of
you did with Suite 100. In parentheses, basement.
Yeah, left that part out, but just these companies, when they heard kind of our background and what we're trying to do in the industry, which was using data to create more local relevance, and part of the advantage we had is we came from the client side. And so we understood all the problems that we dealt with on the client side. And that was part of our inspiration to build a company that was very client focused and helping them solve major problems they were dealing with. But yeah, we got hired, and so that was the kind of celebrate and then, oh crap moment of how are we going to do all this work? And so, Scott lived in Jersey. I lived in Cincinnati. I still live here. And we debated, hey, where do we hire people? Like, should we hire them in New Jersey or should we hire them in Cincinnati? And we came to the conclusion, like, Cincinnati would be a great place to, put the company from an HQ perspective and a physical location perspective, primarily because a lot of great marketing talent with P&G here in town. We got a number of marketing companies here. And then also the cost of living back then was less than the East Coast. And so we felt like this would be, give us a little bit of an advantage on pricing and be able to do great work for our clients. And so, we decided to do it here, which then created a kind of a whole, new layer of work for me. In addition to selling, now I got to help, kind of operate and manage people, find an office, run the office, do all the stuff that every entrepreneur gets to do. And Scott spent most of his time selling, and I spent most of my, I'd say probably 2/3 of my time kind of overseeing, running. And so I moved into kind of the, head of client service at that point, was kind of the next role, and, really focused on building out the team. And then, one of the things, as we grew, Scott and I were so hair on fire, being able to get the work done and grow the business. We grew from, again, 0 to 15 in the first 4 years. Like, one of the things we were really struggling with was like, how do we like find all the right people, get all the work? And so I met another guy here in Cincinnati who had great background in, building companies. And so we brought him on as a partner, and he took the role as CEO at that point, because he had great experience, and, kind of looked at him as a mentor, and he helped me develop. And, luckily, I give him some of the, credit for me still having hair, because he helped me put some of the fires out with how I was wired. And as part of the wiring, EO was really helpful because of the whole Enneagram. I'm a 3 on the Enneagram. There's 9 types, and the 3 is an achiever. And one of the strengths of achiever is I can get a lot of stuff done. One of the downsides is I turn everything into a task, just naturally. It turns into a task. I know how to do it. And so part of that journey we talked about earlier about the personal side of relationships, I really had to slow down and be much more vulnerable for people, because I learned if everything's perfect about me, no one can relate to me. And so I have to be able to show some of the, parts of Jeff Spanbauer that aren't so shiny, and create trust. And so that was part of the journey I went through, of slowing down, learning that there's more than just getting stuff done to be successful. But I kind of led the client service as we grew, from, 2 people to, I think about 80 in 2012 is where we were at. And then moved into the president role. The chief operating role was next. And so the chief operating role was that was when I was hair on fire, just getting stuff done. And that was kind of when I went through that journey of really slowing down to learn how to create relationships and create higher trust. And that was really important, because, as you get into a bigger company and you're able to attract better talent, they don't really want to be told what to do all the time. They want to be, and they definitely don't want to be told how to do it, right? Like, there's a lot of ways to do things. I say there's 100 ways to do every single thing. And, probably 20 are really bad ideas, 60 are good enough ideas, and 20 are really, great ideas, kind of a bell curve. And so, like, that's, one of the things I've had to learn is like turn off the how I want to do it, and kind of empower people to do that. So that was part of that journey as COO. And then moving into president a few years later, as we started to scale, that gave me the opportunity to, really kind of learn my strategy skills and think about really what are we doing as an organization that makes us different? How do we differentiate ourselves? What do we need to focus on internally? Where the resources need to go? And then in 2018, my partner at that time, Bill, he retired from CEO, and I moved into that role. And 2018 to 2020 were really good years. We ended up tripling the business during that time, which was very exciting. And then in 2020 with COVID, we really saw this opportunity. Part of our DNA is this idea that healthcare is local, and the way healthcare operates in Cincinnati is a lot different than Chicago. And so that's why our whole relevance and data-driven model works so well. And so part of COVID is you saw this whole idea that healthcare is local be on steroids. Like, everybody realized healthcare was local. Everybody was going to Johns Hopkins website to see in their zip code how much coronavirus was happening at that time. And so we felt like this is a great time to really scale the business. And that's when we reached out and looked for a partner and found Mountain Gate. And since then, we've grown it from 20 million to 70 million in the last 2.5 years through acquisitions and organic growth. And part of moving from this niche player to really now the one of the key companies in the space of engaging HCPs, healthcare professionals, has been a really great opportunity. And and part of that as you can imagine, the amount of skills and work and stress of growing the company and transforming the company like that. Part of part of that is learning how to also bring in additional I call them MLB players. Like I'm a baseball guy, so we were back in single A ball probably the first few years, and we moved to double A ball. the last, few years we've been in AAA. Now we're hitting the major leagues. And so it's been really awesome being able to bring in major league players in our space and being able to attract them and bring them in. We hired a new CEO, and he's been awesome. We've hired a few other really great players along the way, like a COO, a chief revenue officer, a chief strategy officer. We just hired a chief business officer. And so it's been really awesome being able to bring those people on board and continue to steward the business. But my role now has changed more from, overseeing the strategy and operations to now more focused on our future and through acquisitions and really, as you mentioned at the very beginning, working on the business and coaching and empowering and also sharing history and continuity with the new team. So it's definitely been a dream come true as far as where we started, where I've started, where I have come to. But again, I'm a very forward-looking guy, so I don't spend a lot of time pinching myself, saying I can't believe this has all happened. But at the same time, I'm very grateful for the journey, and am very pleased, and it's exceeded my expectations by a lot, just based on where we are at today.
Yeah. So Jeff, I have one last question. First of all, thank you. Thanks for sharing your knowledge, your experience, your journey. I want to encourage people to check out relevatehealth.com to learn more, and we'll link it up in the notes because there's so much more to dig into. Maybe there's a second episode at some point because you can't just drop, we tripled our business, and I can't dig into that for the next 20 minutes about acquisitions and hiring and leadership. But maybe that's for another time. But I would love to hear, because the purpose goes back to engagement and helping people, right? And so I'd love for you to talk about a radio campaign.
Yeah, sure. I mean, one of the favorite things that I love to talk about in our company is just the impact we're having on actual patients and helping them live longer, healthier lives. And being a step removed from that, sometimes you don't get to hear it. But one of my favorite stories that we got back from a doctor is we did a radio campaign for breast cancer awareness. And one of the areas with breast cancer is if you had it, there's some drugs that you need to stay on for 5 years before you're really cancer free. And so we partnered with doctors across the U.S., kind of making locally relevant, radio campaigns. And some of the doctors we partnered with were in Dallas. And, they talked about, they got on the radio and said, it only takes a few seconds to learn more about the importance of staying on your medicine, a few seconds that can save your life. Some guy heard that in Dallas, heard the doctor who was his wife's doctor on the radio, and that broke through the clutter because it was very relevant to him. Heard what he had to say. He goes home and talks to his wife about it. His wife's like, no, I quit taking that medicine, after about 2 years. And he's like, well, I heard on the radio it's supposed to take 5 years before you should stop taking it. So they went back to the doctor, had a conversation with the doctor, she got back on her medicine, and she stayed cancer free. And so that was just, kind of a huge, not just, validation of what we were doing, but it just makes you feel really good that you're helping people out there that you don't know about, but hearing stories about, a woman kind of forgetting or stopping the medicine, going back, getting it back on because of a campaign we put together. That's the kind of stuff that, makes you feel really good about coming to work every day.
I love it. First of all, Jeff, I want to be the first one to thank you. Check out relevatehealth.com. You can see it on the screen if you're watching the video, and check out more episodes of the podcast. And Jeff, everyone else, thank you so much.
Jeremy, my pleasure. Thank you so much. Have a great one.
What I got, you can't buy. It resides between my eyes. Walked through the fire, came out better on the other side. See, life's like a beach if you find the sailing right now. I'm feeling like $100 grand.